currently for the keynote on a case study healthcare blockchain platform, wherein this platform can be implemented as the core ICD system to which other digital tools like AI, ML, IoT, IOB, medical diagnostic equipment, edge computing, etc., can be integrated. Well, we have with us our speaker, Dr. Paritosh Basu, Senior Professor, School of Business Management, NMIMS University, ex-Global Group Controller and CFO of MNCs. Well, Dr. Paritosh is currently the full-time Senior Professor of NMIMS University School of Business Management in Mumbai. He's a scholarly academician and a digital evangelist and has engaged in various research and consulting activities. Earlier, he served large Indian corporates for about 35 to 40 years, with the last two assignments being of Global Group Controller and CFO in two large Indian MNCs. Well, thank you so much, Dr. Paritosh, for joining us. And it is now time to have you on the World Blockchain Summit. Over to you, sir.
Thank you. Can I start sharing?
Yes, please. Yes, please.
Thank you so much, Bhavna, and thank you for your kind words. It's my pleasure and privilege to talk in this forum, and I'll be extremely happy to share my thoughts with the participants in this forum. My talk is just about 20 minutes, and I'll be spending about 5 minutes for any question and answer. It's this paper which I'm presenting to you. It has been already a published paper, which has been titled as Digital Transformation of Healthcare Services, Recent Developments and Advancements. It was published in this September 2020 in the Management Accountant, a journal of the Institute of Cost Accountants of India. I acknowledge that I'll be using quite a bit of graphics for explaining my concepts, which have not been created by me, but freely available in the cyberspace. And I acknowledge my indebtedness to all the people who have created those and helped me to propagate this knowledge. Of course, I have no commercial purpose behind it. I will be placing this paper with a guidance from the National Digital Health Blueprint of India, which has been circulated by Niti Aayog on 15th of July 2020. From that perspective, I will imagine, and perhaps my participants in the entire conference summit will agree, that the objectives of any digital healthcare system of any country perhaps will be common, and the major objectives will be that I'm going to explain to you shortly. And simultaneously with the objectives which have been stated in blue letters, I will be explaining how healthcare services blockchain platform can meet all the requirements, rather major requirements of a national healthcare system, irrespective of the governance structure of any country. The first objective is establishing and managing the core digital health data and the infrastructure required for a seamless exchange. I personally feel that a digital platform in a blockchain technology area will be able to map all the infrastructure and connect all the infrastructure in an information and transaction recording network, which can help for end-to-end data gathering, which will help for preparation, execution, recording, and delivery of services, including events of transactions in the entire domain of healthcare services to be delivered. The next objective of any national digital health mission would be promotion, adoption of open standards, policies, governance, which will be legislated by the country's government and which will be propagated for the people's healthcare at the best national interest. I'm pretty sure that a blockchain platform which will be having a super smart contract at the entry level of participants, followed by smart contracts which will be embedded digitally in a blockchain platform for all perceivable possible methodologies of service rendering, settlement of commercial transactions, which should be enforceable in any court of law. That should be possible to be embedded in a blockchain platform by way of smart contract. In fact, in a healthcare service delivery, if a doctor or any organization is consultant by an entity or by with an individual who is residing in an overseas country, the smart contract should be able to take care of the rules, regulations, provisions, and policies, guidelines of that country also. So the national digital health ecosystem can be built on the policy guidelines of the country. The next objective would be creating a system of personal health records based on international standards. There cannot be any other best, safe, and digitally enabled platform other than a blockchain platform which can keep the health data in an immutable distributed ledger technology system with complete safety and security. And all these data can only be compiled and recorded and kept in the system with the digital consent of the citizen and the patient. These data will be not only for sickness management or disease management, but also it will be for wellness management. And that is possible without a sense of digital slavery. Digital slavery is something which is a very huge concern of every single citizen of a country. So with the advent of GDPR-like laws in the world, blockchain platform can definitely comply with the situations and give a sense to the citizen that digital slavery is not required. My next point is following the best principles of cooperative federalism while the working with states and union territories. Every country is governed under certain structure, right from the central federal government level to the state level to the local government level of districts or counties, villages, and cities. A blockchain may be a private blockchain or may be a government blockchain, may be operated by a private entity or government entity, can definitely be structured in such a manner that the cooperation, collaboration across the level is ensured. At the end point, it is service delivery to the citizen, and at the state and the country level, it is for developing policy decision guidelines, controlling, monitoring, overseeing, etc., etc. A blockchain platform can definitely serve this. Next is promoting data analytics and medical research. A level of AI and ML can be integrated with a blockchain platform for definitely gathering and taking out the data from the system and continuously provide the same for researchers for continuous research, and that same data can be used for definitely delivering innovative methods of service delivery, whether it is surgery or whether it is medicine or telemedicine or whatever form it is, it can be definitely done. Like MIT is working with ECG records of millions of patients to predict whether a particular patient will be prone to any heart attack or cerebral attack, or a digital scientist of Bhubaneswar, Varisha in India is now researching on various X-ray plates showing bubbles in the abdomen of any patient, whether he or she is prone to cancer. Such data definitely can be provided by blockchain. Next is the enhancement of efficiency and effectiveness of governance at all levels. Application of a healthcare blockchain platform, which will be also having a network monitoring and controlling for IoTs, Internet of Things, Internet of Bodies, AI and ML. All this under the governance and control of the blockchain platform will certainly improve the speed, quality, effectiveness, safety, and security of service delivery. Quality of healthcare, when all these are done in a combined manner, when all these are put into a seamless platform, when all these are done under a governance structure, I'm dead sure about it. It should be definitely ensuring quality of healthcare. Leveraging the information system already existing in the healthcare sector, there can be a lurking fear that all the all the healthcare system which are semi-digital or digital, whether all those will be made redundant with the proposed healthcare service blockchain platform. My suggestion is no. With suitable APIs, application program interface, suitable APIs with all those systems can be integrated. Even a doctor's stethoscope can be integrated for seamless such collection of data. Definitely, there is absolutely no problem. And not only healthcare service, along with that, we can definitely bring in insurance services, banking services, and the services by vendors for various equipment and devices to be delivered to doctors and patients. That can also be controlled. We can also control production of medicine and issue guidance and policy decisions for production of medicines for pharmaceutical companies to follow. I'm trying to explain how blockchain will control in this kind of a situation. This used to be the traditional stethoscope in previous days. Now you have a digital stethoscope, which is a digital facility. This digital stethoscope can take care of any pulmonary sound of a patient and definitely can deposit through the patient's or doctor systems to the common cloud, which can go to the healthcare blockchain platform. This digital stethoscope can also be connected to the smartphone of the doctor with the help of an app which can take ECG. A click by the doctor, that ECG can be deposited in the healthcare record, which can be seen by the families who have consent for the data to be seen, and the consulting doctor who can use those data for deciding his future course of treatment. So the situation here is even if you are a blood sugar patient, and if you need a teleconsultation, your blood sugar data can also be passed on through a Bluetooth or your mobile device to the cloud, which can finally deposit to the HSBP, that is the health service blockchain platform. And after the doctor looks at the data, or the consulting surgeon looks at the ECG data taken by either a healthcare professional or even a nurse system, the teleconsultation is possible and telemedicine is possible. So this blockchain platform need not be only a platform which will be required for hospital management, etc. It can be a one-to-one telemedicine and teleconsultation platform. Let me take you to the main scheme of the platform. This is my idea of the main scheme of the platform. At the center of it is the citizen of a country, and around it you have house physician, consulting doctor, you have pathologist, radiologist, high-end diagnosis system, that means CT scans, etc. Then you have a hospital, you have a banking system, you have insurance company, you have a pharmacy, you have accessories which are required by the maybe denture is required, or it could be possible that he requires a certain stainless steel rods for any surgery. So these accessories can suppliers can be linked, and finally the doctor's own devices can be linked. So what essentially is happening, that the entire number of players in the entire blockchain system, which is connected in these distribution nodes or distribution ledger technology nodes, they will be integrated. And on this integrated system, underlying, there will be a layer of artificial intelligence and machine learning, which will be continuously feeding the data into a system, and through an API will offload from the blockchain system with the consent of the patient, that will continuously deposit the data. All these will function in a very orderly manner, following the policies, guidelines, legislations, the guidance of the World Health Organization, the guidance of the country's health organization, through an embedded smart contract. This digitally embedded smart contract which will be there in the blockchain, as I have explained earlier, will definitely control the entire system in such a manner that all these people function in a manner which will be in absolutely in rhythm, tandem, and orchestration. Where there are human being functioning, there will be chance of litigation, confusion, and chance of errors and mistakes. And there can be litigation reaching to court of laws. These smart contracts will be acceptable to this court of law. And here coming to the bank, this system will be enabled. In India, we have already heard about CBDR, Central Bank Digital Rupee, which is in a contemplation stage. So I, as a digital evangelist, is always thinking of that world will soon have central bank digital currencies in the country, for which IMF has already given the policy guideline for discussion. So all these things, ultimately, the CBDC, if it comes in, it will give a tremendous amount of scalability and tremendous amount of self-containedness in terms of monetary transaction to happen between all the players in the system. And at the end of the day, the digital healthcare passport, which will be issued by the Supreme Healthcare Authority of a country, can be a soft digital healthcare passport for national, international traveling, which we saw in COVID-19 pandemic and requirement. Let me tell you, the people who are suffering from a problem that there will be digital slavery, no data will be taken from you or will be used without your consent. If you don't want to participate, you will be definitely not be forced to participate. And finally, all the regulations of international level, all the standards for maintaining healthcare data will be of international order. So this is my another network. These are the clustered network of the patient's IOB, patient's network. Like tomorrow, your pillows will be controlling your sleep pattern and will give it to your doctor through a sensor attached to the pillow itself. So there will be a lot of IOBs of a patient oxygen intake that will also can be controlled by the patient's IOB network. So this is the patient network, this is the integrated network, and this is the service delivery network. So this entire thing will be working in this fashion. Like if doctor receives a signal of a report from any pathologist, radiologist, etc., doctor receives the report, doctor validates the report, doctor sends the report to the patient. Along with this report, he also sends the prescription, which directly goes to the which can directly go to the medicine provider, that is pharmacist. And this is the pharmacist, and pharmacist can directly deliver the medicines to the citizens or the patient's place. So it's a complete chain of healthcare services, and the blockchain platform, which will be the main platform and which will control the entire system, will be controlling it through digital ledger technology, and thus it will be safe, secured, and it will help the people for an excellent, inclusive happiness. So there I end. If you have any questions, I'll stop sharing. If you have any question, I will always look for the questions.
Thank you so much, Dr. Paritosh. It's always a pleasure. In this case, we're e-meeting each other, but thank you so much for your knowledge, what you've imparted to all the delegates and attendees today. Well, currently, we're going to be closing the event. So thank you all for your time. Thank you so much, Dr. Paritosh.
Thank you so much. Thank you.
Thank you.